Bismillah ar-Rahman ar-Rahim. Yesterday we talked about consonants and we start describing them, and we said the first way to describe consonants is by distinguishing voiced from voiceless sounds. And this is a very easy job in which you can just put your fingers on your larynx and feel if there is vibration in the vocal folds or not. So what causes voicing is the vibration of the vocal folds. So if there is vibration, then the sound is voiced. If there is no vibration or the vocal folds are open, then the sound is voiceless. Today we move into the other way that which we can describe speech sounds. It's according to the place of articulation. Now, most of the sounds that are produced by human beings are sounds that are produced by using the tongue, part of the tongue, and another organ of speech. So before going into details, it's better to just know the name of those parts of speech or organs of speech that are responsible for speaking in general, okay, inside the oral cavity. So let's look at this photo here. Now, this is a photo of a slice of the head, let me say, okay, and it shows most of the organs of speech that are responsible for speaking. Now, the first part here, let's start from the beginning, the things that you can see. The first part here are the two lips, the upper and lower lip, and these are the organs of speech, okay, and then we got the front teeth, the upper and lower front teeth, upper and lower front teeth. Now, what is behind the teeth exactly here in this area is known as the alveolar ridge. Now, the area here, the bony area, it's made of bone. It's known as the hard palate. It is written for you here, palate, but we can say hard palate. And then this area here is known as the velum, or soft palate. Soft palate because it is made of muscles. This area is made of bones. This area is made of muscles, and this area is made of bones. So this one is hard, and this one is soft. Soft palate, hard palate. Then, at the end of the velum, or the soft palate, okay, we got what is known as the uvula. Okay, uvula is allaha. Now, after that, okay, what is important inside your mouth is as well the tongue. The tongue itself is very, very important for production of speech sounds. Usually, the tongue is divided in many different imaginary parts. But for your course here, it's enough to say that the tongue has front part of the tongue, central part of the tongue, back, and root. So front, central, back, and root of the tongue. So these are the parts of the tongue, and then we have the pharynx, al-halq, and then we have the larynx, in which we have the vocal cords or vocal folds. So, and finally, this is the nasal cavity. So again, these are the main organs of speech which are responsible for the production of speech sounds. Okay, it's the vocal tract. Let me clear this for you and re-explain it again. So we start from the beginning here. Okay, these are the two lips. The upper and lower lip, and then directly behind the lips we have the teeth, upper and lower front teeth. Then we have the alveolar ridge. It's behind the teeth, exactly behind the teeth. And then we have the hard palate, the hard palate, and then we have the soft palate or the velum. Soft palate or the velum. Attached to the velum is the uvula. Then we have the pharynx, the larynx, which includes the vocal folds, and the nasal cavity, and finally the tongue. And the tongue is divided into يعني four basic parts: front, central, back, root, and root. Front, central, back, and root. And the lateral sides, the sides of the tongue, are known as rims. The rims. Okay, the rims, the lateral sides. Lateral sides are known as the rims. So this is the tongue. If you want, this is the tongue. This is the front part. This is the central part. This is the back part, and this is the root. Okay, and now the sides here, the sides of the tongue, this area. Okay, let me put it in another color. The area here, okay, the lateral sides of the tongue are known as the rims. The rims. So these are the basic parts of articulation. Now let's move on. Now, according to the place of articulation, according to the point to which your tongue approach, get close to, or touch, or whatever, okay, or the organs that you use to produce a sound, then we can name them according to what they are getting close to. So, if you use your lips, for example, the two lips to produce a sound, then this sound is known as bilabial, like m, eb, etc. Those are known as bilabial because you use the two lips. Bi means two, labial lips, so bilabial, the two lips. Now, if you use the tongue, the front of the tongue with the alveolar ridge, like for the it sound, for example, it sound, then this sound is alveolar. From the name alveolar ridge, it is alveolar. If you use the back of the tongue, okay, with the velum, back of the tongue with the velum, then this sound is velar. Velum becomes velar. Okay. If you use the front and central of your tongue to produce something using the palate, then this sound is known as palatal. If you use your pharynx to produce a sound, like in Arabic, the sound in Arabic, for example, okay, you can, it is known as pharyngeal. Okay, and if you use the vocal folds, okay, to produce a sound like the hamza, the sound, the glottal stop, it is known as glottal. Okay, so let's go into details about these terms. Okay, let's move on. So, the first set of sounds are known as bilabials. And as we said, bilabial sounds are the sounds which are produced by using the two lips. Now, there are some English sounds and Arabic sounds, of course, that we can produce by using the two lips. When your lips comes together, the two lips comes together and they are closed, okay, or semi-closed. Okay, so we produced, for example, the eb sound, the ep sound, the m sound, and the o sound, the wa sound, the o sound. So we got four bilabial sounds in English. We might have other sounds in other languages, but since we are talking about English, okay, we have four sounds that could be bilabial, which are namely ep, eb, m, and wa. Now, sometimes you don't use the two lips to produce the sound. Sometimes you use the lower lip and the upper front teeth. If you use the lower lip with the upper front teeth, then the sounds that you produce are known as labiodentals. A labiodental sound. A labiodental sound. Usually the labiodentals are the F and F. If produce F and sustain it, you will feel that the lower lip touches the upper front teeth. And for the F, the lower lip touches the upper front teeth. So we produce F and F, okay, with the lower lip and the upper front teeth. The difference between F and F is in voicing. F is voiceless, while F is voiced. Try it, please, and feel the vibration as well. Then, sometimes we don't use the lips as well. Sometimes we don't use the lips to produce the speech sounds. Sometimes it is the tongue with the teeth, If your tongue touches the teeth or gets very close to the teeth, very close to the teeth, then you are producing dentals. You are producing dental sounds. Now, dental, and sometimes we call them interdental. Interdental sounds. When your tongue is in between the teeth. Like for the S sound. This is like the th in Arabic. S sound. Or th sound, like th in Arabic. So S as in thin and th as in then. So these are known as dental sounds or interdental sounds. So what is so far we know three places of articulation. First of all, if you use the two lips to produce a sound, then this sound is known as a bilabial sound. If you use the lower lip with the upper front teeth, then this sound is known as a labiodental sound. If you use your teeth with your tongue, with the front of your tongue, to produce a sound, okay, these sounds are known as dentals or interdentals, and examples for that are F and Th. F is a voiceless sound, while Th is a voiced sound. Now, let us go ahead. The alveolar sounds are very, very important, and most of the sounds in English are alveolars. Now, alveolar means the front of the tongue. Let me say in general, the front of the tongue touches the alveolar ridge or gets very close to the alveolar ridge. Among the sounds that are produced by this way are the it, ed, s, n. Okay? Sounds. So we have voiced and voiceless sounds. So it, ed, s, is, and n are alveolar sounds. We call them alveolars. In addition to that, we have the L sound as well. The L sound. Look here, the L sound. Your tongue touches the alveolar ridge, but the rims of the tongue, remember when we talked about the tongue, we said that we have the rims. The rims are important for the production of L sound because they are lowered, whether one side of them or both sides of them are lowered. And finally, the R sound, whether the trilled R that we use in Arabic or the flap R, okay, which is the one R. Okay, so L and R as well are alveolars. So far we have few sounds that could be known as alveolars. Again, it, ed, s, n. Okay, L and R are pure alveolar sounds. Those are the alveolar sounds, and again, these sounds are produced whether by touching the alveolar ridge, like for it, ed, n, l, and r, or they are getting very close to the alveolar ridge, like for s and is sound. This would be enough for you for today, and we'll continue tomorrow, inshallah. Thank you very much.